good morning to everyone in our Facebook Live today, and this is the actual event of the Open Day, which is on the 24th September 2025, where we have Dr. Chua Peng Teng, which is our Obstetrician Gynaecologist from Mahkota Medical Centre with us. Today, he is actually being invited, to actually doing a live demonstration to showcase our first hematory in Malaysia robotic-assisted surgery system over here. Hi, Dr. Chua, good morning.
Good morning, good morning.
Great to have you today.
Yeah,
I believe that your patient can't see you today because you are here with us today.
Yeah.
So, Dr. Chua, tell us about what is robotic-assisted surgery.
So, basically, robotic-assisted surgery is the surgeon using a surgical platform like a hematory you're seeing here to aid the surgery, to help the surgeon do the surgery, right? With more precision, more accuracy, as well as giving small incisions on the patient for faster recovery and less pain.
Okay, that is very great. So it's basically assisted the doctor to do the surgery.
Yes.
But many at times, allow me, Dr. Chua, to invite you over here. Many at times, right, patient will say, robotic surgery. Now we don't need doctor anymore. Is it true?
No, it's absolutely a misconception. Actually, the robotic system still needs a surgeon, right? What happens is that the surgeon will be sitting here. Okay, this is called the surgeon's console. Now, when the surgeon sits here, he or she will operate from here, and the actual robotic arm is here on the side. And this is the patient model. So imagine that this is the patient. So the surgeon sits here to operate the controller and move the arms of the robot, and it will move accordingly. Why don't I just show shortly how it works?
Yes, that is very great, Dr. Chua. You show a short live demonstration how it is being done. I will help you with the mic.
Okay, so you see, for the hematory robotic system, through Asian culture, you have to take out the shoes first, right? Wear clean socks. Then only you go to the console. Okay? So we have our Sister Vivian with us. Sister Vivian, please show Sister Vivian in the camera.
Hi.
So Sister Vivian is an important part of our nursing team. She will show us, how to operate the robot, right? So I'll just put the mic to Carrie. So you see, right now I'm at the surgeon's console, right? So I'm actually moving. If you look at the screen there on the left-hand side of myself, right? So if you look here, this screen here, right? So I'm actually operating on the robot, okay? So if at the same time, you see if I'm operating on the robot now, now you can move your camera to the robotic arm. You can remove the robot. So you see I'm moving in here now, and you can see the robotic arm moving. Carrie, are you seeing the robot arm moving? So you see I am controlling the robot and not the other way around. So the human surgeon is needed to operate the robot. So that is to answer your question. So you can see I'm just giving an example of how we make the suture. Right? So you see we are controlling it at the same time, can move the camera focus to the robotic arm for them to see. So you see the robot is following my orders. So we still need the surgeon to operate, right? So the robot is following my orders. So it's not operating independently. Okay? And actually many people ask this question. So we are making the suture now. So I'm sparing it, so this is a simple one today. So and you can see I can move my vision very clear. Right? You can see even the small crevices or the dust. You can actually in fact pick up the dust if you want. So it's a very good magnified vision. You can see all the texture of the silicone tab here. Right? So you can even pick it up. So you can see the dust I pick up actually. So you can pick up even the dust. Can you see the dust here?
Yes, that's very amazing.
Yeah, it's very, very fine.
It was so small and you yet able to pick up with the robotic arm.
Yes, exactly. Carrie has a very good point. So now I'm just going to make a simple one. So in the actual human body, the tissues are more pliable. This one is a very stiff pad, so don't mind me. But anyway, this is how we normally do some suturing. And then we are going to square the knot. Okay. So this is basically how we do the knotting, right? And we actually have another arm. So with the robotic system, we have 4 arms. This is arm 1. The vision is arm 2. Arm 3 is this one. And this is arm 4. Okay? So now what happens is that arm 4 can be called to help. So you can call the arm 4. And when the arm 4 is moving, this arm tree is static in place. So you can see now my arm tree is coming, right? It's helping me hold. Now I press the pedal on the console, and then I switch back to these two hands. So basically I have 3 hands with the robot. Now I have 3 hands. And okay, Denise, are you there? Can you change to Caesar? Okay, can you please focus on our stuff now?
Okay, Miss Vivian, what are you doing right now?
I'm changing the instrument for the doctor.
Okay, so definitely. Alright, very great. So in the actual operating theatre, definitely doctor is not operating alone. He was actually being assisted with our professional, trained and well-trained operational theatre nurses, right? So Miss Vivian, what have you actually gone through in order to be a certified operating theatre robotic-assisted surgery nurse?
I need to go through a few hours of online training session, and then after that I've gone through the training in Singapore. After that we have the certification programs in Singapore, and we passed with flying colors.
Wow, very good. Pass with flying colors. Congratulations. Okay, now we move back to Dr. Chua.
Okay, so you see now we look at the robotic arm, you see, without the surgeon, it is static. There's no movement. So you need a surgeon to operate. By default, you cannot allow the machine to operate on a human being because ethically, morally, and legally, there's a problem. Okay, so always somebody must be responsible, and the doctor and the team is responsible. Okay, so you can see when I'm stepping out, nothing is moving because the robot cannot operate on its own. It doesn't have a brain of its own, but it is a great help. The hematory is our friend, and it is our, our partner in treating the patient. So if I go back again, then you can see the robot will follow my movement again. So you can see now what I'm going to do is I'm just going to go really close up. Just like when you're trying to kiss somebody. You can see the hair here, right? You see, very fine. You look at the screen. I hope they are showing them the screen, Gary, because you see the hair is here. So if I don't like this small hair, I can actually try to remove it. So you see, you can go all the way up, remove the dust like this now. You see, I remove the dust.
Wow, amazing! Yes,
the dust is not. We are removing dust. We're not removing the. Can you see the dust here? This is the dust.
Yes, exactly.
So now I can put back the dust. Can you see the dust?
Yes.
Yeah, so it's so small and so fine. So this is something that is very difficult to do with a conventional human eye. Now what I'll do is that I'll just demonstrate how we cut the suture. It's very simple actually. So see, it's very precise. Can you see the cut ends? It's so precise. Right, very clean, right? So, and it's just one snip to do. And you see now, because I have 3 hands, 1, 2, 3. So the arm fall, now I can switch it back and move my arm and then put this out elsewhere. So it's like you have all your hands inside the patient. So then you can move it and then put it aside. Alright? So you can put it aside. So I'm glad that Carrie asked all these questions because it's I think like burning questions from a lot of people. So I do the last one, Carrie, and then we can
Sure.
So now I'm just going to remove this suture, very simple one. So in fact, if you don't want to cut the suture, you can use the fine movement to remove the suture, right? So if you really want to, you can in fact, just angle it. It's just like a hand. And then that's it, no need to cut.
Wow, amazing.
Yeah, so then I put aside. So, and you see the view, I can zoom in and zoom out whenever I like. Now I'm putting it aside, and I'm throwing it away, so you see my hand can go all the way up here. Now I switch it back. I just put it in position. And then you can clap your hands, clap, nobody's clapping, so I clap my hands. So, okay.
Thank you.
So I'm just joking, right? Okay, because otherwise I sound very boring. So
Well, Dr. Chua, seems that you have 3 hands with robotic-assisted surgery
So
system.
in fact we do have 3 hands. And then people like our staff, like our fantastic staff, like Sister Vivian and the rest of them, they actually sometimes put in another extra hand. So it's like 4 or 5 hands at one time. So you can understand then why it's more precise and it's more efficient. So So you see, the biggest thing about the robotic arm is if you are doing, I believe Terry, some of the audience asked what is the difference between laparoscopy and robotic, right?
Yes, exactly.
Okay, so you see, if imagine, okay, let's say if I put this aside, right? So imagine, you see now robot, the thing is that you have 7 degrees of wrist motion. So this is just like a human wrist. Maybe you can focus on my hand, focus on my hand. You see, so you can see my hand, right? Okay, you can see my hand. Right now I'm actually at a straight neutral position, right? Now you can move it out like this. And you see when I move it out like this, it shows them on the screen. The robot hand also moves out like this, right? Now if I move it down, you look at my hand again. You see the screen again? So robot also meaning the movement is moving down. So you see, if I rotate my arm like this, right? My wristed movements, right? So you see if I move it like this, right? You look at the screen. So it's also following my movement. So this is something that the laparoscopic surgery we cannot get this. So laparoscopic surgery will be like this. And you see the screen, this is laparoscopic surgery. Okay? It's a straight stick. And for laparoscopic surgery, this is it. Your movement will be, like this. But for the robot, you can move 7 degrees of freedom on the wrist. I hope I answered your question.
Yes, definitely.
What is the difference between laparoscopy and robot? Okay? And you see, when again, you see, the surgeon always needed for the robot because again, if I step up like this, you see, the arms cannot move. It's frozen. The shoulder is frozen. It's frozen.
Yes, I think the myths have been busted.
Yeah.
Definitely robotic surgery need a surgeon, not only a surgeon, a very professional and trained surgeon to operate.
So, but if I go back in, right now the robot listens to orders again. Can you see?
Yes, we can see the
You can
hand
see the
movement.
hand movement is moving
Yes.
again. Can you see now?
It seems that robotic hand is actually flexible, right? Can turn around. How many degrees and can turn around?
It's 7 degrees of motion on the wrist.
Oh,
So because it's just like a human wrist, right? You can go up, go down, right? You can go left, go this one, and then you can connect the supinior. So these are the 7 degrees. So up, down, and let me try to make it clearer for you. So you can see here. So I'm pressing because this button is the clutch. So go up, neutral, go down, you go inside, you go outside, right? Then you pronate, just like how when you're cooking, you turn your hand, you're flipping the egg, see? And then you flip the other way around. Can you see?
yes.
Yeah, so 7 degrees. So is it like correct? My mathematics is correct. Please forgive me. It's not correct. 1 up, down, 2, 3,
That's very good.
4, and then 5, and then 6, and the neutral is 7. So this one is
Yeah,
7 degrees.
that explains the benefit of why certain surgery, especially those that are very delicate and hard to reach surgery, will require a robotic-assisted surgery.
Yeah. Okay,
right?
so if the audience wants to know why is it good for hard to reach areas, it's because of the camera. So if you look, Sister Vivian can show you. See what Sister Vivian is showing you now. This is the camera. It's a 3D camera. So whatever we are doing, whatever we are seeing is all dependent on this camera, and you can see. Terry. So you see, for example, right? Let's say now I have a very big size patient, and I need to go very, very big. So normally, for laparoscopy, this will be limited to here. Because that laparoscopy is not good. Laparoscopy is very good, okay? But there's limitation to how much your assistant can help you move your camera. Because right now, in robotic surgery, the camera is controlled by me, right? But in laparoscopic surgery, your camera, you either have a human operator, which is your assistant, or you can have a special arm just to hold the camera. But usually, in laparoscopy, the human will hold the camera, usually. So now, Terry can move the mic aside. Okay. So you can see now, let's say if I want to reach this area, right? This is very deep, okay? Imagine this is somewhere very deep. The camera is now in my hand. I can just move it very easily. Right? Just like I'm going very near, you can see. I hope you are showing them the screen.
Yeah.
Okay, so you see, I can move very near. You see, it's very deep, right? But I'm going nearer and nearer, and at the same time, I'm moving all the arms. Can you see?
Yes, very clear.
Yeah, so you can see, you can go very deep. And in fact, right now, I'm only limited because my camera is too near my instrument now. But if I really want to go very near, let me show you. Sister Vivian try to move the things all like this. And I try to go just with the camera. Let me see if I can do it. Okay, never mind. So I think so you see, I can go very, just like climbing a mountain, like moving, and then you can also twist and turn your wheel.
Wow.
Okay? Can you see I can move the angle
Yes.
to my comfort. So you can see, you can go very near, but okay, let's say it's just like the dust that I showed you just now, the example just now. Okay, you can go very, very near. See? Can you see how close I am?
Yes.
Can you see this dust?
Yes, can.
So I think today we do a lot of dust kicking exercise. Can you see
Yeah, exactly.
how near we are? We are basically right in the face of the thing, the organ or something. So show them the view inside the box. You can show them the view inside the box. How near the camera is. Very near, right? It's very near.
Yes.
So you see how near the camera is, the thing. So that is why for deep access or hard to reach areas that normally we cannot reach by conventional methods, robotic surgery, especially with the robotic platform is superior. So you see now, you can see the dust here.
We can't even see actually from our naked eye.
Yeah, it's so small and I think it's
Yeah.
hard to begin the job. So I think the dust is back here.
Yes. I think that really clearly explains how the 3D vision of this robotic assisted system can show how clear a surgeon vision when operating the patient.
You can see the dust is somewhere here.
Yes.
I pick it up now, it's no longer there.
Yes.
Okay, so I think that
Okay,
explains
good.
it.
I think this benefit definitely explained very clearly. What about the cut? Right, I can see Dr. Chua over here, the stomach right, of a patient. It is not being cut open surgery. It was only like an incision. So what will happen to the patient after they perform the surgery?
First of all, to answer your question, we do not make big cuts for this kind of surgery because this is a minimally invasive surgery, one of it. So what happens is that the surgeon will make small incisions about the size of the tip of the finger. So it's about 1 centimeter or less, right? Then with that we insert these specialized cannulas. So maybe Sister Vivian, you can withdraw the robotic arm. So what Sister Vivian will do, she will remove all the arms. Okay, remove all the arms, right? Just remove the arms. Okay, so I'll just show you how we normally put in the instruments and then how it goes about. Okay, I think it's okay. So you see, normally what happens is that before we can put in the robot, right? The surgeon will have to take out the cannula, put in the cannula. So imagine, this is a fresh abdomen, there's nothing here, fresh. Vivian can take it out. Okay, so it's like this. So we leave it here for them to remove this. So this is a clean abdomen, right? So what we do is that we have scalpel, right? We just cut small holes. You can come and see the hole. So the hole is about this big. Okay, this small hole here. So this is the size of the incision. Then once the surgeon has done that, then the surgeon will put this cannula, or we say trocar, with the cannula, and then put it in. So then this forms the entry point. So you normally put 1, 2, 3, and 4, and sometimes the assistant will have another one, 5. So total, 4, 5, or 3. So it actually depends on the case. So the incisions are very small and pain is less. So to answer what Carrie asked, normally for all this kind of surgery, within 1 day, the patient can be up, can be about, can have some food, they feel very well. Some of the patients go scuba diving after 3 days or 1 week. Even though we feel very worried for them, but they can go to travel after a few days. But obviously, we normally advise them to rest longer because everybody is different. My body is different, your body is different, so it depends on the person. But normally recovery is very good and pain is less. Most importantly, the pain is much less. Some patients really appreciate it. For example, the mother came and had surgery with us. After that, the daughter also came and had surgery with us. And even though the daughter has one more hole, the daughter don't mind. So this is how good it is. So I hope that answers your question. For the skin outside, usually recovery is very fast. within 1 or 2 weeks it will dry up and then you start to see, you know, that the wound is getting better. So, but within few days you can be discharged from the hospital if everything is fine.
Yeah, I think that's a very great news for ladies and women, right? Because example, cesarean, we have a very big heart and it will last for our whole life, right? But for this robotic-assisted surgery, for example, Dr. Raya, OMG, so what would be the type of surgery that you usually perform?
Okay, so yesterday actually I delivered a lecture and have some videos, but today we don't have it. So almost, you see, basically a lot of gynecology disease or women's health disease, right, can be tackled with a robot. It can be anything. It can be anything from a simple cyst, big cyst, a smaller cyst, medium-sized cyst, fibroid, hysterectomy, removing the uterus, you know, even cancer cases, uterine cancer, many can be done. So, in fact, if you ask me, across the board, very few scenarios whereby we cannot use the robot. Meaning, today if you have a problem, right, women's health problem, most likely the robot can help you tackle the problem. Very rarely the robot can be very rare. But also depends on the patient and the case, okay? Because everybody is different.
That is very clear. I think it's a very good news for all the women around the world, Malaysia and around the world, right? That we have this kind of like latest technology that allow the doctors to actually do the surgery. And I heard that actually some of the benefits that some women still want to preserve their uterus for conceive later. So with robotic-assisted surgery, they have some chances, right?
Yeah, definitely. I mean, just with any surgery, it actually depends on the case and depends on the problem. So, if the uterus can be preserved, obviously the robot can do a job, you know, to remove the disease and then preserve the uterus. That is definitely possible.
Very great. I think with that, all the benefits, right, many of us will actually be wondering, robotic-assisted surgery, how much the robotic-assisted surgery for gynecology actually costs?
Okay, you can see it. You can see I'm smiling because it's a very tough question. If I answer correctly, I don't get benefit, but if I answer wrongly, I become public enemy for some people. So, but I can tell you, actually, it is not as expensive as you think. You see, health is something very valuable. We do not really see the value in health carrying. A healthy body is wealth. Okay, you must remember. But you see, we can take loans to buy the new phone. We can take loans to buy the new car. We can take loans to buy the apartment. But we cannot spend money to take care of our body. So this is actually a very sad thing. Very sad thing. But okay, anyway, because I'm beating around the bush, what I want to tell you is that in general, our robotic platform is actually slightly cheaper compared to some other systems in the market. I cannot disclose to you exactly how much because I'm not an accountant and I'm not a mathematician, I'm a surgeon. So, but it's anywhere between 10 to 15% cheaper than conventional cost. So that one I can tell you. So if today you have any friends who have had a robotic surgery, so in general I think it's a safe figure for me to quote that for the hematopoietic platform, the estimated cost is about 10 to 15% less. It also depends on the case. Because you see, sometimes just now I had a patient who came and asked me about a difficult problem. So you see, normally patients don't come and see us early. You see, you must remember, if you see the surgeon early, you see the doctor early, obviously the cost will be cheaper because your problem is simpler. Now the problem is everybody comes to see us after they have seen 5 or 6 doctors. They have waited for 3 to 4 years, and the situation becomes very bad. Now when it becomes that bad, sometimes we operate for 10 hours. So the longest I've operated on this system is 12 hours. So you can imagine how much cost a 12-hour surgery using the robot is going to cost. Compared to if you treat early, we do it in 2 or 3 hours, obviously the cost will be cheaper. And the consumables and the drugs and everything we use will be much less. Alright, that makes sense. So I hope that the audience see the value in your health, exercise, take care of the body. I'm telling myself also, we are not going to get younger anymore. Exercise, look after yourself, do prevention, early detection, and then do not wait until the last minute before you go and see the doctor. Then obviously your bill will definitely be cheaper. Right? And always be honest with ourselves. Tell the doctor what the problem you actually have. We are there to help you. We are not there to judge you. Remember that. We are not the judge. We are surgeons. We want to help you settle your problem. Be honest with us, and it will be good for you. Okay.
Wow, that's very great.
And I want to say thank you to all of them and our excellent team at Mahkota Medical Centre. I cannot name all of you, but you know who you are. And also to the management, I think you really care about patients, and thanks a bunch for making this happen. Thank you so much.
Thank you very much.
Okay.
Bye-bye.
Yeah.